Doc, I had almost decided to do a transplantation, but what I read recently shook me. It seemed two people died out of hair transplantation in Kanpur, and I was told that those surgeries were done by dental surgeons. I can't understand how can a dental surgeon treat hair? Another patient. Doc, I was about to do transplantation, but then I read that somebody in Kerala developed severe necrotising fasciitis, swelling of the face, and the concerned person who operated him was not even a plastic surgeon or a dermatologist. Why? What is happening? Is it such a risky procedure? Why did these patients die? These are the questions that I have faced in the last 1 or 2 weeks. Now let us examine what has happened. We tell everybody hair transplantation is a safe surgery. Hair transplantation is a local anesthesia surgery. There is no admission. You can go home the same day. You can travel the next day. All this we say. Yes, that is correct. If this is so, why did two people die? Why did one person have such serious complications? Natural questions. If you really look into it, the surgeries, the patients who died in Kanpur, two people, two engineers, two young engineers, their surgery was done by dental surgeons. Now, when I read this news, even I was a little shocked. Why should a dental surgeon do hair transplantation? Somebody studies about teeth, oral mucosa, mouth, jaw. Why should he think of doing hair transplantation? Difficult to understand. And likewise, the person in Kerala who developed severe infection, he was not a plastic surgeon, he was not a dermatologist. So, why is this happening? This is happening because hair transplantation is perceived to be a simple procedure, OPD procedure. But it is a safe procedure only if all the protocols are followed. If all the facilities for treating a patient is available in the hospital. National Medical Council 3 years back has put up guidelines. What are these guidelines? Dermatologists and plastic surgeons can do hair transplantation and aesthetic surgery. Doctors with proper training can only do this surgery. These hospitals or clinics where they do the surgery should have all the necessary equipment, facilities for resuscitation, trained people for handling emergencies. All these things are laid down. But what is happening in reality? Because patients want it cheap and there are people who think they can do it because it is simple, they are operating in beauty clinics, saloon, spa, dental clinics, everywhere. And who are doing these procedures? MBBS doctors, Ayurvedic doctors, sometimes not even doctors, technicians, they themselves are doing. And in this case, you find dental surgeons have done it. Now, what has Dental Council told about this? Dental Council has issued a notification sometime last year that maxillofacial surgeons can do aesthetic surgery. Yes, they can do aesthetic surgery on the face because they operate on the mandible, that they are qualified to handle. But hair transplantation, it is not in their syllabus at all. So, our association, IADBL, Plastic Surgery Association, has appealed to the Ministry of Health that this is not correct. Even going by the Dental Council regulations, even if maxillofacials are allowed to do it, other branches of dental surgeons are not allowed to do it. Dental surgery includes general dental surgeons who usually remove teeth and do minor things, prosthodontics, cosmetic dentistry, orthodontics, etc. Oral pathologists, they are all not capable of doing the surgery. They have never studied hair. Dermatologists, plastic surgeons, we study hair. Now this is so ludicrous that it is hard to believe that in the 21st century India, where there is so much advancement in medical science, a dental surgeon thinks of doing a transplantation. I am a dermatologist. Can I think of operating on the heart? Or can I think of operating on the mandible? What is even more surprising is that patients are falling prey to social media advertisements which speak of these things. So now, who is responsible for this? If you ask me, three different areas. One, we doctors, we are in a profession. We are not in business. That means we have to practice our profession with ethics and empathy. Ethics means practicing what I have learned, practicing what I have been trained for. I cannot endanger the patient's life, or any doctor cannot endanger the patient's life just because he or she wants it to be done. If a doctor is not capable of handling it, he should refer. So dental surgeon should not operate for hair transplantation. So appeal to doctors, please restrict yourself to your core areas of training. Next, the patients. Patients these days have access to information. By click of a mouse, one tap, you can get any kind of information. So you can know what is this clinic, what is the doctor doing, what is his qualification, what is his training, everything you can find out. And then you can access any guideline you want. NMC guidelines have already spoken to you. Then we have guidelines by IADVL, we have guidelines by AHRS, we have SOPs by AHRS. All these guidelines are there. Anybody can read them. If these are not adhered to, then HT is not a safe surgery. Like recently, in about 4 or 5 years back, there was a death in Chennai, and that surgery was done by somebody in a spa. Can you imagine a spa doing a surgery? And then 2-3 years back, there was a surgery done in Delhi, which resulted in death. Who was doing the surgery? Technicians with no qualification, just SSLC and PUC. Can you imagine? So patients also have a responsibility. Don't bother just about the money, bother about quality, bother about safety. So check the clinic, whether it is recognized or not, whether the qualification is recognized or not. If you don't have the money to do the surgery, plan it, do it next year. Nothing is lost. Is money more important than life? No. Then the third is regulatory agency. For example, in Karnataka, we have Karnataka Private Medical Establishments Act. They have classified clinics into clinics, polyclinic, hospitals, class 1, class 2, class 3, etc. Each one has a specified list of qualifications. It is there on the website. Check it. Then only you should go ahead with the surgery. If a clinic is not seen whether it is KPME registered or not, then complain to KPME or go to another clinic which is registered with KPME. Check the qualification. Is he a IADVL member? Is he a Plastic Surgery Association member? Check these things. Only then you should do the surgery. So my appeal to patients also, please check. It is your life, your health, not just hair, health. Nothing is more important than life and safety. So don't hurry into procedure. For example, in our Venkat Center, I am there. I have been doing transplantation for 24 years. Then we have Dr. Aniket, plastic surgeon trained in multiple centers abroad. Dr. Mihir, plastic surgeon. We have a facial plastic surgeon. So 4 surgeons and a trained team of 8 people. We have been doing it since 2003 in India and 2001 in other countries. We have been trained in multiple countries across the world. We have written guidelines, we have written textbooks, and we have trained scores of people from across the world. So you are assured of absolute safety when you come. Now you can see some photographs of our operation theatre and of our center. They have been designed with the best possible international SOPs, keeping them in mind. So absolutely safe. You should choose a procedure of this type. So my appeal to everybody, safety is very important. Protocols are very important. SOPs are very important. Safe place, safe hospital, safe operation theatre, safe procedures, safe protocols, safe SOPs, all these together make for a safe hair transplantation. Do not compromise this safety for the sake of money. Plan properly, do research properly, seek the right doctor, seek the right hospital. Thank you very much.